Cardio Fitness Digital Storybook. Heart rate is defined as the number of heartbeats in a unit of time, normally measured in beats per minute. It is based on the number of contractions of the ventricles. Normal heart rate for adults is 60 to 100 beats per minute. This can be altered with fitness level, exercise, air temperature, body position, emotions, and may indicate abnormalities as well. Carotid pulse. To palpate the carotid pulse, the patient must lie supine. The examiner positions their fingertips between the larynx and the anterior border of the sternocleidomastoid. Pressure is then placed with the index finger and the middle finger only. Radial pulse. To palpate the radial pulse, the examiner supports the forearm with the hand in a supinated position. The examiner then uses their free hand to palpate along the radial side of the wrist, just below the hypothenar of the palm. Pressure is then placed only using the index fingers, never the thumb. Femoral pulse. To palpate for the femoral pulse, the patient lies supine. The examiner palpates along the upper thigh inferior to the inguinal ligament, 1/3 the distance from the pubis to the inferior iliac crest. Examiner stands to the side of the patient, pressing firmly in the groin area. Brachial pulse. The examiner needs to support the patient's forearm while the patient maintains a slightly flexed and abducted elbow. Then the examiner's free hand finds the pulse at the anterior aspect of the elbow, just medially to the biceps tendon and lateral to the epicondyle of the humerus. Another way to find the brachial pulse is to find the brachial artery just medial to the belly of the bicep. Target heart rate. This is the Carvonen formula. It is a mathematical formula to determine target heart rate training zone. For example, Rachel is a 21-year-old female whose resting heart rate is 65 beats per minute. She wants to know what her target heart rate should be at training 60 to 70%. 220 minus 21 is 199. Then, 199 minus her resting heart rate, which is 65, is equal to 134. Then take 134 multiplied by 60% for the intensity, which equals 80.4. Then add back her resting heart rate. Therefore, Rachel's target heart rate should be 145.4 beats per minute. Heart rate measurements. To measure heart rate while performing exercises, one can perform pulse palpations by counting the number of beats per minute. A heart rate monitor can be purchased to monitor heart rate as well. There are numerous types: a wristwatch and chest monitoring set, or a fingertip monitoring, to name a few. Blood pressure. Blood pressure is defined as pressure exerted by the blood against the walls of the blood vessels. This is expressed in millimeters of mercury as a fraction of maximum pressure that follows systole of the left ventricle and the denominator that represents dystole. When taking someone's blood pressure, a sphygmomanometer is used. This is what commonly is known as a blood pressure cuff. The patient is seated in a chair with their arms resting on a flat surface that is level with the floor. The patient's feet should also be flat on the ground. Palpate to locate the brachial artery. Once found, the cuff should be placed directly over this point. The examiner then places their stethoscope in the antecubical fossa or crease in the arm, locating the strongest pulse sound. Begin to inflate the cuff so that the meter reads about 200. Slowly release the air. Listen for the sound. This is the systolic number. Keep slowly letting the air out until the second sound is heard. This is the diastolic number. Also, if the noise is unable to be heard, a visible jumping of the needle can be used for a backup figuring out what the systolic and diastolic numbers are. Normal blood pressure is around 120/80. Anything higher can be a cause for concern. Queen's College Step Test. The Queen's College Step Test is a way to determine the athlete's cardiovascular fitness. The athlete is instructed to warm up 10 minutes prior to this test. Athletes step on a box that is 16.25 inches tall. Athlete steps up in an up, up, down, down pace. The test lasts 3 minutes total, and the athletes are told to hit around 22 steps per minute for females and 24 steps per minute for males. A metronome is a setup to set the pace for the athlete. Upon completion, the assistant allows athlete to rest for 5 to 20 seconds, then takes their pulse for 15 seconds, then multiplies the number of beats by 4 to get how many beats per minute. VO2 max equations. From the results obtained directly after completing the test, the examiner is able to determine the VO2 max for the athlete. This is obtained by a mathematical equation. For males, VO2 max is equal to 111.33, subtracted by 0.42, multiplied by beats per minute obtained. For females, VO2 max is equal to 65.81, subtracted by 0.1847, multiplied by the beats per minute obtained.